can't talk and do, obviously, at the same time. It just goes loosely on the knee, and yeah, it's just setting there, and that's too far, so we'll cut that off. There's no tension applied, okay? What is that?
Oh!
No, it's, I just didn't know what it was. It was weird. Of course, you keep exercising. That's good.
Would that be the same? Would that be the same as that band that you showed us?
No, this is a very different thing than the band. But good question. The band goes here and just around. This is a different technique.
Okay.
So the cover roll just goes on, and the reason is that this is the tape over which you put the really important tape.
So this is just basically
Like a
ensuring
barrier.
that tape is going to stay on.
And so you don't
No, it
do that.
ensures that the other tape
is so
would
strong.
rip your skin off.
Yeah.
Oh, so it's like
Barrier.
John and I watched this.
We did-
Yeah,
we did a
and
lot
this is
of
not
this.
going to be my
Yeah,
best
last
technique, so
semester.
if you're taping this, please don't put it on YouTube.
We are.
Yeah, I have.
This stuff has been here for a long time, and it's curly. Normally, when you take it off, it lays flat, so it's not.
I still have a couple of rolls at home.
Do you? Did
Yeah.
you use this too?
Yeah.
Did you
But-
use it before or after surgery?
Before I was
Don't
trying
have any
to
nails, so I'm having a problem.
trying to pull my patella medially.
She's nervous.
No, I don't have any. There we go. So we just want to put this on. We don't want any gaps in it. We don't want it to be real wrinkled, so it's fine. And then we have the Leukotape. And this is a different brand of it, but this is so adhesive. And you don't want to put this directly on the skin anywhere on anybody because it would probably damage the skin as it comes off. So what I'm going to do for Mel, if I can borrow somebody's, I'm going to just outline her patella. And this is going to really require a little more than what I'm going to do. I'm going to do it relatively quickly. But if I look at her patella, and I will need to do this in a position where her leg is flat, and I'm going to feel that her condyles are equidistant and not rotated internally, externally. And then I look to see, does the patella seem to be more lateral than I want it to be? Is it tilted? And I can kind of adjust for that. No, that's okay. I know what I'm going to do. I'm going to try just the medial pull with you. Then what I'm going to try to do is actually create a little medial pull of the patella by applying this piece of tape. And I'm going to do this while bunching up the medial side. Then I lay the tape on and then applies a medial pull to the patella. So,
Makes sense.
some of the interesting part in the research about this is people who have this condition, you would think, because usually you track too far lateral, you pull it medial, it should help. Sometimes when you do the same technique to people, but you pull the patella laterally, it also helps. And that doesn't really make sense. But that's why, some studies, it's okay. I got it. All right, so we need a little piece of this. No matter what size I pick, it'll always be too long.
Isn't that tear pretty
Oh, no.
easy?
No.
Isn't it like
You
that?
need scissors for this. I do anyway. Welcome to try. Why don't you send that around so people can pull a little bit off and just feel. And so when I put this on, what I'm going to do is I'm going to set it on, and where I put this exactly is going to depend on whether I feel there's a little tilt to the patella versus whether it's pretty flat. If I think there's a tilt, I'm going to apply it over from here over. If I don't think there's a tilt, I'm going to apply it from here. And I think there's a little tilt, so we'll split the difference. So I put that on, and then I pull, and I always call it the little baby's butt. Crevice.
Baby's gluteal fold.
Yeah.
No, I saw that in public.
And I always, as I said, go too long, and then I end up with some of this on the skin, and it's okay. So what this then feels like is weird. I'm going to do Sarah's with kinesio tape just to show you can do it with less adhesive tape, and it sometimes helps too. But unfortunately, we don't really have any major pain before. So what I would do is have her repeat those provocation tests with the tape on and see if it made a difference. If it did make a difference, she could wear this tape when she was doing regular activities. She could wear this tape when she went running. I sometimes wear it when I run if I'm having some issues.
Something you can apply yourself.
Yeah.
Self